Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Management. So, management of the renal injuries. So, in the renal injuries management, it is mainly non-operative management is done. Actually, 95%, that is more than 95% of the cases are actually managed by non-operatively. Okay, they are managed non-operatively, almost 95%. If there are significant renal injuries are seen, that is grade 2 and grade 4, these are only found in 5% of cases only. Significant renal injuries like grade 2 and grade 4, grade 2, grade 3, grade 4, grade 5 are seen in only 5%. Next, if a patient is a hemodynamically stable patient and the injury is well staged by a CT scan, with the CT scan, if we have staged the injury properly, then we can manage the patient without renal exploration. In such cases, in such cases where the patient is hemodynamically stable, we do not need to open the patient. Second, hospital admission can be done. Bed rest is given to the patient. Vital monitoring should be done. Along with that, a repeat CT scan is required for the patient. So with the help of this, we will have to just monitor the patient. If the patient's condition progresses or deteriorates, only then we do a surgery.
thank you and thank you for watching.